Today we're going to talk about the signs of labor and when it's time to go to the hospital. Hello, my name is Samantha, and I'm a registered nurse. With a change in hormones, your body will naturally go into labor, usually at the end of pregnancy or around 40 weeks. Some people may go into labor early, before 37 weeks. In any case, it is important to know the signs of labor. First, let's talk about practice contractions. Practice contractions, also known as Braxton Hicks, are common. But what are they? These can be uncomfortable and even painful, but they are not labor contractions. They are irregular and they usually go away with rest and hydration. You can drink fluids like water or juice to match your thirst. Now, let's go over the labor contractions. Labor contractions help your cervix thin and open, and they are one of the signs of labor. Here's what to look for when you have true labor contractions. They come regularly and they become closer as your labor progresses. For example, they may happen every 15 minutes at first and then gradually become more frequent. They last longer, usually 30 to 60 seconds each. They get stronger and more painful over time. You may feel them in your belly, lower back, and even your thighs. They don't stop when you rest or change positions. They continue no matter what you're doing. They are painful enough that you have trouble talking or walking during a contraction. You usually need to breathe through these contractions. Tip: try the 5-1-1 rule. Are your contractions every 5 minutes that last 1 minute long over 1 hour? Other signs of labor may include vaginal discharge that is bloody, increased mucus leakage or discharge from your vagina, sometimes with a small amount of blood. This is your mucus plug. A sudden gush or a slow leak of fluid from your vagina. This could mean that your water has broken. This is when the bag of water around your baby breaks. It is important to remember what time this happens. A strong pressure in your lower belly or pelvis that doesn't go away, like the pressure when you need to use the bathroom. Some people even experience shivering, nausea, vomiting, and runny stools. If you notice any of these signs, it's time to call your obstetrical assessment unit or head to the hospital to be checked. While most of the time labor happens without any problems, it is important to know when to contact your healthcare provider or obstetrical assessment unit right away. The following signs may indicate a problem. You have bright red bleeding from your vagina. You feel constant pain in your belly that doesn't go away. Your water breaks and you get a fever or feel hot and shivery. The fluid leakage from your vagina when your water breaks is yellow, green, or red. Your baby's movement has slowed down, for example, less than 6 movements in 2 hours. Every pregnancy is unique. If you have worries or concerns about your pregnancy, always reach out to your healthcare team. It's better to be safe and reassured. Thanks for taking time to listen to this video. It is a great step in preparing for your birth and your baby's arrival. Stay informed, stay calm, and trust your instincts. For more information, please visit the ottawahospital.on.ca and parentinginottawa.ca. And don't forget to like and subscribe.